Hello students, welcome back to the study portal. Today the topic that we are going to discuss is emergency care procedure. Please keep this in mind that this topic will be based on the hospital procedures, right? Inside the hospital setting, what are the emergency care given to the casualty or to the patient, right? So the learning objective for our today's topic is understanding what is an emergency care, what are the aims of emergency care, what are the legal considerations you should keep in mind while providing emergency care to the patient, and what are the emergency care in different types of situations like bleeding, shock, burns, choking, poisoning and asthma, etc. Right? So moving on to our topic, first thing that we will learn is what is an emergency care. What do you mean by the term emergency care? Emergency care is basically a simple or effective management or care given to a casualty of injury or sudden illness until more advanced care can be provided. Any type of sudden casualty of injury like broken bones, bleeding, dislocation, or any kind of injuries like of road trauma accident, right? And of sudden illness also, sudden illness like asthma attack, heart attacks, stroke, right? This kind of sudden illness can be the effective management or care given in this type of sudden illness is known as the emergency care, and this care is given until more advanced care can be provided, right? Now, what are the aim of medical emergency care? The aim of medical emergency care is to first preserve the life, that the patient does not end up being dead, and to protect the unconscious casualty, that no further injury or further pain can happen to the patient, and to promote recovery. These are the four aims of the emergency care. First one, to preserve life, that the patient stays in a good state, right? To protect the unconscious casualty and to prevent further injury or pain. If the patient comes with bleeding, severe bleeding, the main aim of the emergency caregiver will be to stop the bleeding, apply pressure to the site or stitch up the torn area, right? And to prevent further injuries, like if the patient has broken bones, the caregiver, what will it do? It will prevent the broken bones from further breakage, right? So the patient does not do any kind of activities that will result in further breakage of the bones, and to promote recovery, right? When the life is preserved of the patient, only then, after then only the patient will be given some advanced care, right? Now, what are the legal considerations in emergency care? There can be a variety of situations that the patient could be of MLC case, that is medico legal case. The patient could be unconscious, or the patient will not be having any one for their guardian or their guidance for, or parents, or any legal guardian, right? So how will you acquire the patient's consent? What are the documentation procedures for that kind of patient, and how will you ensure that the privacy of the patient is maintained? And the doctors must also be aware of their duty of care and the potential for breach of duty claims if the patient is not conscious, or there is no guardian with the patient, right? The doctor should not do any kind of things that will breach their duty claims, right? If the patient is not conscious, or if the patient is not in a very good state, that you can already judge that patient will not give any kind of money to the hospital for the care given, right? Neglecting all these factors, the main thing for a doctor is to preserve the life of the patient, right? And also, while preserving the life of the patient, doctor must keep these things in mind, right? Now, what is a patient consent? Patients must be fully informed of the risks and benefit of the treatment. Doctor must assess a patient's capacity to consent. In emergency, consent for treatment is usually implied. If the patient is in conscious state, or if there is a guardian present with the patient, right, above the age of 18, what will you do? That you will inform the patient or the patient's guardian for the risk and benefits of the treatment, that what is the treatment you are going to give to the patient, what are the risks of the treatment and what are the benefits of the treatment, right? And the doctor must also assess the patient's capacity to consent. If the patient is unconscious, you will not ask the patient to give you a consent, right? Or if the patient is conscious, then how much of the information can the patient take comes under the patient's capacity to consent. And in any kind of emergencies, consent of treatment is usually applied, right? If the patient is not having any kind of guardian, or if the patient is not in a very conscious state, the consent of treatment is usually implied, because what is your aim? It is to preserve the life of the patient, right? Now next thing is documentation. What is documentation? Proper documentation is important to avoid negligence claims. Medical legal reports includes the facts observed by the doctor and their opinion. Documentation is when a patient comes to the emergency department, you will document each and everything that information is present at the time, right? If the patient is unconscious, you don't have the patient's name, age, etc. You will just write the patient was arrived at this time in this ambulance, the patient was at this state, right? There should be a supporting document for to save the doctor from any kind of medical legal case or any kind of breach of their duty, right? Medical legal reports includes the factor observed by the doctor and their opinion. Any kind of medical legal case, let us say if the patient is medically in medical legal cases, what cases comes that patient was at the risk of being dead by someone else, right? Like attempt to murder or any kind of rape case, right? These kind of cases come under the medical legal reports. So the medical legal reports includes the factors that are observed by the doctor and their opinion, that what was observed by the doctor, what was the state of the patient, and what was the doctor's opinion about the patients, right? So these documents should be verified, and this should be done under the certain guidelines, right? Now, what is privacy and confidentiality? These principles apply, but there are exceptions such as mandatory reporting. The patient's privacy, the patient's name, age, phone number, the patient's injury, or the patient's illness, the patient's medical report should not be shared with anyone else other than the patient's guardian, right? But in some cases, mandatory reporting is required, like if the patient is of medical legal case, and the mandatory reporting to the police officer or to the other doctor is done, because these cases are exceptions, right? So the patient's privacy and confidentiality must be conserved until and unless there is an exception. Okay. Now, duty of care. Doctors may be charged with breach of duty if their actions put critically ill patients at risk. If you see a patient who is not at very good state, or if a patient who you might know personally was not good to you, but at the time when you are in the hospital, you keep everything related to your personal life away, and your just main duty is to save the patient. If a doctor is found to put a critically ill patient at risk, he or she will be charged with breach of duty, and they will have to face some legal consequences, right? Now, what are emergency declaration? In India, the government can declare a national emergency to suspend fundamental rights and address a crisis. All of these things that you studied about, privacy and confidentiality, duty of care, documentation, and patient's consent, these all things can be put under the case of exception whenever there is a emergency declaration, right? Like for example, let us say at the time of COVID, what was happening, that without your consent, if the patient is found to be COVID positive, the patient without their consent also what put under the isolation. The patient's temperature or the COVID testing was the camps for COVID testing were set up at every area, every tolls, right? And with or without your consent, because it was the order of the government, right? So with or without the consent of the patient, the COVID testing was carried out, and if the patient was found to be COVID positive, the patient was put under isolation, right? Many of the patient were there who opposed these things, but these things can be put aside due to government declaration of national emergency to address a crisis, right, to stop further spread of the crisis, right. So this was it about your today's topic. The next topic that we will discuss will be emergency care in different situations like bleeding, choking, etc. We will cover it in next video. Thank you.